Vaccination is one of those ideas that sounds simple on the surface but is actually an elegant biological strategy. At its core, vaccination means giving the body a safe preview of a disease threat so the immune system can prepare before the real threat appears. Instead of waiting for a dangerous infection to teach your body a lesson through illness, a vaccine teaches that lesson in advance, under controlled conditions. This matters because many infectious diseases spread quickly, and by the time symptoms appear, damage may already be underway. Vaccination shifts the timeline. It turns immune response from reactive into proactive. That single shift has changed life expectancy, child survival, and the baseline safety of everyday life in schools, hospitals, and public spaces. In this video, we'll break down what vaccines contain, how immune memory is created, why herd immunity protects even people who aren't vaccinated, what history teaches us from smallpox to today, and why coverage rates matter so much more than many people realize. So what exactly is in a vaccine? Different vaccines use different ingredients, but the common principle is exposure without full disease. Some vaccines use weakened live organisms that can still trigger immunity but are much less likely to cause severe illness in healthy people. Others use killed organisms that cannot replicate. Many use only specific proteins or inactivated toxins from a pathogen, enough for immune recognition without delivering the full biological threat. Think of this as showing the immune system a high-quality mugshot rather than releasing a dangerous suspect into the body. Once introduced, immune cells identify these components as foreign, activate defensive pathways, and begin building targeted responses. B cells produce antibodies that can bind to the pathogen. T cells coordinate attacks and help shape longer-term protection. Most importantly, memory cells are formed. These cells can persist and respond faster and more effectively later. That memory is why a vaccinated body can often stop infection early, reduce severity, or prevent illness altogether when exposed in real life. To understand why vaccination works so well at scale, we need to look at adaptive immunity. Your immune system has a rapid, general first line of defense and a slower, highly specific second line. Vaccines train that specific second line in advance. Without prior exposure, the adaptive response can take precious days to ramp up during real infection. During those days, pathogens multiply, symptoms worsen, and transmission can continue. With vaccination, your immune system has already rehearsed. Antibodies and memory cells can engage earlier, often before the pathogen gains a major foothold. That translates into fewer severe cases, fewer hospitalizations, and fewer opportunities for a disease to spread. Importantly, vaccine effectiveness is not an all-or-nothing switch. Even when infection still occurs, prior immune training can dramatically reduce risk of complications. This nuance gets lost in public debate, where people sometimes treat breakthrough cases as proof of failure. In reality, reducing severity and transmission pressure is a major success in itself, especially across entire populations. Now zoom out from the individual to the community. Herd immunity happens when enough people are immune that a pathogen struggles to find new hosts. Transmission chains break more easily, outbreaks shrink faster, and explosive spread becomes less likely. This protects people who cannot be vaccinated or cannot mount strong immune responses, including some immunocompromised individuals for whom even weakened vaccines may be unsafe or less effective. In other words, vaccination is both personal protection and shared infrastructure. You might never meet the person your immunity indirectly protects, but your choice can still affect their risk. Herd immunity is often misunderstood as a fixed number, but in practice the threshold depends on how contagious a disease is, local contact patterns, and immunity durability. The key idea remains constant: high coverage creates friction for disease spread. Low coverage removes that friction. Once enough gaps appear, outbreaks can return even in places that once felt protected. That is why public health emphasizes sustained coverage, not one-time success. The real-world impact of vaccination is extraordinary and measurable. According to the World Health Organization, vaccination prevents roughly 3.5 to 5 million deaths each year. A WHO-funded Lancet analysis estimated that over the 50 years beginning in 1974, vaccines prevented around 154 million deaths, including about 146 million among children under 5. Those numbers are not abstract. They represent families kept intact, childhoods that reached adulthood, and health systems spared catastrophic burden. Vaccination is widely regarded as the most effective method for preventing infectious diseases, and that conclusion is based on decades of epidemiology, surveillance, and outcome data across countries with different income levels and healthcare structures. In many regions, diseases that once dominated fear and mortality became rare or disappeared from daily life because routine immunization made mass susceptibility collapse over time. When people say modern life made some infections seem distant, they are often unknowingly describing the success of vaccination itself. The paradox is clear: the better vaccines work, the easier it becomes to forget what they prevented. History makes this even more vivid. Long before modern immunology, communities sought ways to prevent smallpox, a highly contagious and often deadly disease. Records of variolation in 16th-century China show that people were already experimenting with controlled exposure to reduce risk. Variolation was a precursor, but it still carried danger because it involved live infectious material. The breakthrough came in 1796 when Edward Jenner developed the first smallpox vaccine and, crucially, published evidence of effectiveness and practical guidance for production. Later, Louis Pasteur expanded the scientific framework through microbiology, helping turn vaccination from isolated practice into a reproducible medical method. The very word vaccination comes from vacca, Latin for cow, referencing the cowpox connection in Jenner's work. What began as a risky early practice evolved into systematic prevention science. That evolution matters because it shows progress is not just about discovering an idea, it is about improving safety, standardizing methods, and building evidence strong enough for society-wide adoption. Smallpox itself is the ultimate case study in why vaccination is historically transformative. Before eradication, smallpox caused devastating mortality. Estimates suggest it killed 20 to 60% of infected adults and over 80% of infected children in some contexts. Across the 20th century alone, smallpox is estimated to have killed roughly 300 to 500 million people. Those figures are almost hard to emotionally process, but they frame the scale of suffering that infectious disease can produce when populations lack immunity. By 1979, smallpox was declared eradicated globally, an achievement made possible through sustained international vaccination campaigns. Eradication is different from control. Control means reducing disease burden. Eradication means the disease no longer circulates naturally in humans anywhere. That outcome required scientific tools, logistics, surveillance, public cooperation, and political coordination across borders. It remains one of humanity's clearest demonstrations that coordinated preventive medicine can permanently remove a deadly threat from normal life. Few public health accomplishments can match that level of finality and impact. It is also useful to clarify terms that often get blurred in conversation. Vaccination and immunization are frequently used interchangeably in everyday language, and in many contexts that is fine. But technically, vaccination is the act of giving a vaccine, while immunization refers to the process of becoming protected. Inoculation is an older and broader term that can refer to introducing biological material, and historically it included practices using unweakened live pathogens, such as classic variolation approaches. Why does this distinction matter? Because precision improves public understanding. If people confuse all forms of exposure-based prevention as identical, they may import fear from older, riskier practices into modern vaccines, which are designed under very different safety and quality standards. Better vocabulary does not solve disagreement by itself, but it reduces avoidable confusion. And in public health communication, confusion is costly. The more accurately people understand what is being done to their bodies and why, the easier it is to make informed decisions grounded in current science rather than historical memory fragments. No honest explainer should ignore concerns and resistance around vaccination. Reluctance has appeared throughout history for scientific, ethical, political, medical safety, and religious reasons. These concerns do not all have the same quality, and they should not be treated as one monolithic category. Some questions are legitimate requests for clarity on risks and benefits. Others are rooted in mistrust, misinformation, or identity conflict. Major religions generally do not oppose vaccination, and some frame it as a moral responsibility because it protects life, including vulnerable people. On safety, modern systems include monitoring, investigation, and in some countries compensation pathways for alleged injuries. In the United States, for example, the National Vaccine Injury Compensation Program exists as a legal mechanism for claims. The existence of such systems does not imply vaccines are broadly unsafe. It reflects a societal approach that combines large-scale prevention with accountability mechanisms. In practice, building trust requires transparency, respectful communication, and consistent evidence, not dismissal, not panic, and not false certainty. The consequences of low vaccination rates are not theoretical. When coverage declines, diseases can return in places where people assumed they were gone. This has happened with multiple preventable infections, often amplified by vaccine hesitancy and uneven access. Outbreak dynamics are unforgiving. Pathogens exploit pockets of susceptibility. A country can have strong national averages yet still face local outbreaks if specific communities have low uptake. That is why public health strategy must combine broad campaigns with targeted outreach, access improvements, and culturally competent communication. It is also why success must be maintained, not celebrated once and archived. Vaccination programs are living systems that require supply chains, trained personnel, surveillance, and public confidence year after year. The practical takeaway is straightforward: immunity gaps are opportunities for disease. Maintaining high coverage is less dramatic than crisis response, but it is far more effective. Prevention rarely looks heroic in the moment, yet it is exactly what prevents avoidable tragedy from becoming normalized again. When we put all of this together, vaccination emerges not as a single medical event but as a civilizational technology. It combines biology, statistics, ethics, logistics, and social trust. At the individual level, it prepares immune memory. At the population level, it reduces transmission and shields vulnerable people. Over decades, it reshapes what societies consider normal risk, allowing childhood, education, travel, and healthcare to function with far less background threat from infectious disease. The historical record, from early inoculation attempts to global eradication of smallpox, shows both how far science has come and how much collective coordination matters. The modern challenge is not only to invent vaccines, but to sustain confidence, access, and coverage in a fragmented information environment. If there is one core message, it is this: vaccination works best when viewed as shared responsibility backed by evidence. Its greatest successes are often invisible precisely because they are measured in disasters that never happened, lives never cut short, and futures that remained open. If you found this helpful, please like this video and subscribe for more explainers.